New Mexicans struggling with a mental health crisis will soon have a new resource to get timely, effective help. It's designed on the now familiar model of 911 for medical emergencies. The three digits now are 988. The hotline was a bipartisan federal effort signed into law by then President Trump in the waning months of his presidency. It's described as an extension of the National Suicide Prevention Line and is expected to be up and running by July of next year. State officials are holding listening sessions right now to help them formulate a plan for implementing the federal hotline here at home. And Senator Griego, this has obviously worked well with 911 and even 311 here in Albuquerque. I'll remind folks for getting answers to basic questions surrounding city services. Hey, you were around at council when that thing got put in place, as a matter of fact. Do you think this could make an impact in terms of mental health services? Is this what we needed to have a direct line here?
So I'm all for more opportunities for people to access services, but the bottom line, like 911, like 311, you got to put the resources behind it. So if we have some place to call, you got to be able to refer somebody. And our biggest problem now is there aren't enough services for people who need basic mental health care. So if we put our money behind it and really fund the kind of infrastructure on mental health, so when you call, you can get services, I'm all for it. I hope it's not just a way to channel people and say, hey, why don't you try calling the Medicaid office on Monday and see if you can get an appointment next October, which is what happens now, unfortunately.
That's
often,
right.
Right?
Mm-hmm. That's a fair point. Senator Snyder, experts like the U.S. Surgeon General have said we are headed for a mental health crisis coming out of this pandemic. People have been living in largely survival mode. But New Mexico has an additional wrinkle, of course. We're still trying to recover from the dismantling of the state's behavioral health system. So is this new hotline going to help with any of this?
I sincerely hope so. One of the things that I learned over the last few years is that New Mexico nationally has the highest suicide rate for veterans of any other state, and that within that we have the highest suicide rate for women veterans.
Oh, wow.
So we don't have, as Senator said, we don't have the resources. So with the phone line, which is, I think, an excellent idea, you've got to put those resources into place. I am fully for it. I think but we need to stop pretending that, talking a good game, I guess is what I'm saying. Get with it and get the resources in place.
Julianne, the benefit of the three-digit hotline, according to supporters, is that everything is streamlined. No chance of drop calls, 911, 311, all that kind of thing. That makes some logical sense, it seems to me, when someone is really in a tough jam. Am I thinking of this wrong? It seems like that's not a bad way to go here.
No, but I think it will take a long time for it to catch on and really be useful to people. It's the reason why New Mexico had to start using the area code when we dial, not just the 505, but the 575, wherever you are, you have to use that now because many phone numbers in our state, including the phone number for the reporter, begin with 988. So I think that's one thing that, people will be catching on to. I'm just also concerned about getting the message out, and will the people who need this message the most really receive it? I'm thinking about teenagers. Our state, as the senator said, we've got one of the highest suicide rates in the nation. It affects young people. Between 2014 and 2018, fully a third of the suicides in our state were people between 15 and 24.
Wow.
And so making sure that young people know about 988 and are willing to use it, and when they use it, they actually get a targeted service that helps them. I think those are some of the challenges ahead.
Senator Griego, is this an opportunity for us to, boost behavioral health resources? And what more are we missing beyond just a hotline, which we've had for a while now in terms of suicide prevention? Is there another step beyond this line we could be taking?
Well, you mentioned the dismantling of the behavioral health system. I think we're still not where we need to be. I think we're trying to rebuild it. I think if we're serious about a comprehensive, deep strategy on dealing with behavioral health, it's the kind of dollars that we're prepared to invest. It's kind of like this whole early childhood constitutional amendment and the funding we've been talking about. You have to start from how are you going to get people to go into the field so that you you have enough people in social work and counselors to actually meet the demand. But anyone who's tried to access this care for family members or for themselves knows that it's a very, very tough. If you don't have insurance, it's really tough to access. And so I think if we're serious about it, let's put our money where our mouth is, and let's put the kind of resources that we've put into, for example, law enforcement. Like we can never possibly give enough money to law enforcement. Well, I think even most people in law enforcement was like, yeah, we need to be better funding behavioral health and mental health services so that would make our lives and our community safer and our jobs easier, because we're underinvesting in it. And that's across the state. Even the places that have really made commitments to it are not really investing enough in that pipeline for providers, and then making it really easy to get services, not just ask for services, but to actually get the services.
And we all expect our police to be handling other things at this point than these type of calls. The public listening sessions on the New Mexico rollout of the 988 hotline continue through September 23rd. We'll have information on our website about how you can participate in those remaining sessions. You can also track that info on all things NMIF on our YouTube, Facebook, Twitter, and Instagram pages.